Hi guys, so the Prime Minister announced on Thursday something that wasn't in the party manifesto, the abolition of NHS England. Now this had been introduced by a previous Tory government over 10 years ago, but Keir, Starmer and Wes Streeting are closing it down and merging it into the Department of Health and Social Care. Here the Health Secretary Wes Streeting was asked about the change of heart and such a dramatic change in policy, and he dismissed the idea that it was ideologically driven and more based on experience. But is it a good idea?
But you must have gone on a journey, because who was it who said this? I don't feel the need to come in and make my mark by top-down reorganisation. Do you know who said that?
That was me.
Yes.
And that's absolutely right.
So what changed?
Experience of the last 8 months. So when Andrew Lansley came in, he was the Conservative Health Secretary who came in after the change of government in 2010. He came in with a ready-made plan, top-down reorganisation. He imposed it on the system, cost billions of pounds, and it was the most disastrous reorganisation in the history of the NHS. What I'm announcing today is the final nail in the coffin of the Lansley reorganisation, and I'm doing it not out of ideological dogma, but out of learned experience of the last 8 months, assessing how the system's working, looking at how these two organisations interact, and recognising that there is value to be gained in having one centre, one head office, because you save hundreds of millions of pounds and you have clarity of leadership. But here's the bigger, more fundamental reform, as well as a smaller centre doing the things that only we can do nationally, in terms of things like procurement and the data, and new life sciences and research and national standards. Those are the things you'd expect the centre to do, but giving more freedom, more power, more flexibility to the front line, because the best reforms I've seen in the NHS are led by clinicians on the front line, clinical teams. So we've got to give them more trust, more control, and we've got to give more power to patients as well.
Okay, so a lot of positive things there, but I think it's also important to look at the potential costs of removing NHS England. So first of all, what are the benefits? Well, of course, as he mentioned here, there'll be a reduction in bureaucracy. At the moment, you have two government departments doing pretty much the same thing. You have the Department of Health and Social Care, and you have NHS England. So if you merge one into the other, you can lay off a lot of staff, you can close offices, you can reduce a lot of the cost. So that would be a benefit. You can have faster decision making. So instead of having to go through two departments, you can go through one department. And government ministers have been complaining over the last number of years about how slow decision making has taken when it comes to NHS England. You can have greater accountability. So instead of having two departments, you have one department. The government minister has to have oversight of just one department as opposed to two. And generally, patients will be better off because there will be less waste. Patients will be able to access services faster, and it should be more streamlined. Now, as I said, there are also potential costs here. So there will be a disrupting transition period. You can't just close down a government department overnight. So you're going to have to move services over. You're going to have IT systems that need to be closed down or merged into the other department. That's going to take time. There may be different standards, and this will create inefficiencies in the meanwhile. You're also going to run the risk of losing specialized professionals who work, the thousands of employees that you're going to have to lay off. Some of these may be needed in the Department of Health and Social Care, and they may be lost during this transition. There's also a risk of political interference. Remember, government departments, there's a lot of politics within those government departments, and some people may resist the change. Some people may demand that they are moved into the other department, and this could create problems for the government and the health minister in particular. And when you're laying off staff, this can cause a massive impact on morale. A lot of people who have dedicated their lives to working in the health service, and in particular over the last number of years in NHS England, may feel that they've been thrown on the scrap heap. So this could impact the morale even of the new department or the Department of Health and Social Care. So there are some costs here, political costs, maybe even some economic costs as well. But on the whole, it makes sense to provide a better service. And I think a lot of the commentary I've heard so far since this decision has been pretty positive. It's extremely expensive having two government departments when you could have one do the job of both of them. But the priority has to be providing better care for patients. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.